A human foot X-ray is a useful diagnostic tool. Normal foot X-ray. A human foot X-ray is a very useful diagnostic tool for evaluating foot alignment in a pediatric patient. The human foot is comprised of 30 joints, 26 bones, and more than 100 muscles. The structures of the feet work together to perform a number of functions that are essential for healthy living. The structure of the foot is made up of 7 tarsal bones and 14 phalanges. The tarsal bones are similar to the wrist carpal bones. The tarsal bones are classified into proximal, intermediate, and distal phalanx. A foot X-ray is a diagnostic imaging test that uses X-rays to show bones and soft tissues. An X-ray image shows darker colors for muscles and soft tissue, while white colors are used to visualize bones. These images have helped doctors diagnose many conditions, including bone fractures, pneumonia, and arthritis. The images can help with the diagnosis of dislocated joints and other painful conditions of the foot. A foot X-ray is a non-invasive procedure that uses very low doses of radiation to produce high-quality images. While the exposure to radiation is minimal, the baby is particularly sensitive to the radiation. If you are pregnant, it's a good idea to let the X-ray technician know. Similarly, if your child is undergoing the procedure, it's important to explain the procedure to them so they are as comfortable as possible. The X-ray of the foot is a diagnostic imaging test that uses radiation to create a 3-dimensional picture of the foot. An X-ray image of the foot will reveal the bones and soft tissues. Bones and muscles appear white in an X-ray image, and soft tissues are shaded darker. Radiographs can also detect joint deformities and dislocated joints. A radiograph can also be used to identify symptoms of tenderness and pain in the foot. The human foot X-ray is a unique diagnostic tool. It can be used to diagnose common symptoms, including dislocated joints and broken bones. It can also be used to diagnose fractures and diagnose healing problems. It can be used to assess the results of surgeries. A medical professional can also use an X-ray to detect tumors, cysts, and other abnormalities in the foot. A doctor can use it to plan and monitor a patient's condition and recommend treatment. A human foot X-ray is the best diagnostic tool to evaluate the anatomy of the foot. It can detect broken bones and dislocated joints and can be used to help determine the correct alignment of the bones and their healing. It can also detect cancerous and infectious diseases in the foot. The X-ray is an ideal tool for diagnosing and tracking disease in a patient. In addition, it can help doctors plan and assess a wide range of conditions. A human foot X-ray is an important diagnostic tool for a variety of medical purposes. The X-rays used to examine the human foot can help identify diseases and other conditions. The AP CAT scan provides a detailed look at the foot in a traumatology hospital. A femur X-ray can also be used to assess bone density in the body. It may also be helpful to determine the severity of an injury by examining a patient's joints and assessing how it affects the structure. In addition to a CAT scan, DAI is an advanced X-ray imaging technique used to visualize soft tissues. The technology has been used to diagnose breast and knee pathologies and has been used in rabbits. It is also an excellent choice for medical professionals to diagnose foot injuries in children. It allows them to see the foot in anatomical detail. This is a unique type of X-ray, which can detect diseases and other ailments that can be easily treated. Generally, a foot X-ray is safe, but the exposure to radiation is minimal. A single exposure to the radiation is enough to determine the presence of bone in the foot. This process usually takes about 15 minutes, and the exposure to radiation is very small, resulting in a high-quality image. It can also help to diagnose diabetes. Moreover, the study can help physicians determine if a baby is growing inside the mother.